facing that way mostly. Whatever, somewhere.
Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Welcome back to Open Mics with Dr. Stites. Today, we mark a milestone. 4 years since the start of the COVID-19 pandemic. The health system admitted its very first patient with COVID on March 9th of 2020. 2 days later, the World Health Organization declared a pandemic. And exactly 4 years ago today, on March the 13th, the United States declared COVID a national emergency. Without vaccines or natural immunity, the novel coronavirus continued to spread around the world. Check out this old video. Here we are, Hawkeye and I, on March the 19th for the very first time, sitting in the studio to talk to update local media. Look at how great our infection control was. Let's see. We were like within 3 feet of each other, and we were huddled over a speakerphone. In hindsight, we could have been a little further apart. We might have been wearing masks. Oh, wait a minute. I even had on the same shirt. I want to just tell you, that was not planned. That was a complete accident. But we were building the airplane as we were flying it and acting on the best available data. And then we had stopped wearing ties because we thought ties could spread infections. Well, you know, we don't know exactly how history will remember the COVID-19 pandemic. But we can look into the past and see how the world has responded to other pandemics. Turns out we're not the first ones to try and build an airplane while we were flying it. Wait a minute, these pandemics happened before airplanes. We weren't the first ones to try and fly by the seat of our pants. Maybe I do need a new analogy.
That one works, though.
I think it does work.
Yeah.
Fly by the seat of our pants. That's pretty good. Joining me today is Dr. Chris Krenner, an internal medicine doctor by trade, but also a history buff. He is so much more. He is the chair of the Department of History and Philosophy of Medicine. He's a longtime friend of mine here at the University of Kansas Health System and Medical Center. I am delighted to have you on the program. And we're going to get a little bit of a history lesson because now that COVID is sort of very recent history, sort of, we can compare it to some other historical events. Now, a little later, we're going to check in with Dr. Dana Hawkinson. But Hawkeye, I know you're down in Olathe this morning. Thank you for joining us. You're rounding. You're doing good work. You know, this infectious disease thing is pretty near and dear to your heart. I'll probably reach out to you before we get to the COVID part and talk with you a little bit. I want you to engage in our conversation with Dr. Krenner. If you're watching live, please feel free to share your thoughts or questions with us. All right. Dr. Chris Krenner, nothing happens in a vacuum. And when we talk about pandemics, we're also talking about politics and economics. Take us back to the 1800s and the first modern pandemic, so to speak, cholera. How and why did cholera spread? Tell us about that story.
I call it the first modern pandemic. There were pandemics before, but this was fast. It traveled along trade routes that had been established by new kinds of technologies. It concentrated in urban areas, and it was global for the first time because we could reach all the globe. And it started, this is an old map, but it sort of shows a little bit of how fast and how far cholera spread. I guess Dr. Hawkinson would call it cholera vibrio, the bacteria that caused the disease. Started in India. It had been present in the Ganges River basin for hundreds of years as a very stable endemic disease. People had adapted to it and had a sort of social structure that kept it from spreading. But with British colonization of India, it disrupted those stable patterns. People were on the move, they didn't have the usual water supplies, and this waterborne bacteria spread quickly into the British troops, British traders, and it followed paths of commerce and military adventurism all across the globe. So we see a disease that caused millions of deaths quickly spread across the country, largely because of these social changes, following the paths of British colonial adventures in Indonesia, went into China with the opium trade. That kind of led to the Opium Wars in a couple of decades. And then hopped over the Atlantic in 1832 to the United States and was just a plague along the big coastal cities that didn't have, at that time, sanitary water systems. And no one knew what the cause was at that point. And cholera came like this all through the 19th century in waves, one wave after another emanating out as new strains or new kind of transport happened. Eventually we got a handle on it. Took till 1854, a really brilliant physician, John Snow, was able to convince people during the cholera pandemic in London at that time that this was a waterborne disease, and that if you cleaned up your water, you could change things, and just followed in suit. Before that, it was all kinds of things were tried to stop the pandemics, including something that got Andrew Jackson, President Andrew Jackson, into some hot water.
So to speak, hot
so
water.
To speak, hot water, yeah.
It would have been helpful, actually, if they used some hot water, boil it
would
up.
have been nice. People thought, well, we don't really have a solution. We should try prayer and fasting. And they called on Jackson to declare a national day of prayer and fasting in 1832 to stop the pandemic. And Jackson, probably better known today as a military leader and a scourge for sort of indigenous southeastern tribes that he really catastrophic violence kind of drove out of the southeast and into that western migration. But ironically, he was a big stickler for kind of law and order and the words of the Constitution. So he had these national cry for a day of prayer, and he said, no, there's Article 1 of the Constitution is the Establishment Clause, and he interpreted that as we're going to keep a separation of church and state. So he was an unusual character, had some principles, other times seemed to be carried away by, kind of some passions that we think in retrospect were, terrible things. But that was the first modern pandemic kind of wound down by the 1880s as we started to create good water supplies in the U.S.
What did people need to do with cholera to make the water safe?
It just was a matter of just draw your water above the place where you dump your waste. It seems pretty obvious.
Yes.
I think probably this is what was going on in the Ganges for a long time.
Yeah.
But in some of the big cities, they hadn't quite. Certainly in London, that was clearly one of the problems. And in 1854, Snow was able to isolate the water that was coming from below certain sites of waste dump from the water that was coming from other places, and then created a map of London showing where cholera hit and mapped it against the water supply.
Kind of like how we followed COVID down the interstate routes from one city to another city here in the United States.
Absolutely. You can follow the paths. So that was the first modern pandemic. But it wasn't the worst. The worst modern pandemic was probably the 1918 influenza epidemic.
Spanish flu, or some people might call it the Kansas flu.
It may have started, there's a good theory it started in Kansas. The Spanish flu, of course, the Spanish called it the French flu, and it went on from there. But it never got back to Kansas. It may have started in Fort Funston, is one theory. But it hopped quickly over to Europe and didn't strike in America until a little later in 1918, after the outbreak in Kansas. It was devastating. It killed probably 20, 30 million people across the world, far greater numbers than even COVID, which we just experienced. But it was very highly variable where it struck. So it hopped to Europe and started to come back into the United States in late 1918, early.
Really just probably taken across back and forth by sailing vessels.
Yes, and with the troops.
And
also refugees. War is always a disruption that is followed by pandemic disease because it unstabilizes the social structures, makes people vulnerable. And so coming back, the back and forth travel across the Atlantic brought it back. And some cities fared better or worse than others. I have a slide that shows a little bit of what we saw in New York City that did a little bit, had a little improvement. This is a surge of flu deaths.
That could have been a COVID curve right there, but it's really a flu death curve in New York City.
Just hits all at once, spreads quickly through an urban population. We've seen this again and again. And here you see the brown box. Those are the measures that were taken by the public health officials in New York City. And see, the box starts before the curve rises. So the curve was flattened, although it looks terrible in New York. You can see there in the corner, we have some masking, social distancing, quarantine in place in New York.
So people knew to even mask against influenza spreading, because we know influenza is also a respiratory disease and spread primarily through secretions.
People were sneezing, coughing, and the doctors were smart. They caught on. This was how it was transmitted. They knew, and they knew that masks would help. And it did, and they were able to show that it did. In Philadelphia, where you didn't use masks, you had this kind of curve. And
So it seems like in a shorter time frame, but man, look at that peak.
yeah, almost twice what hit in New York City. On the worst day, there were 700 people dying, and in Philadelphia saw the kind of greatest fear from pandemics. You know, there was a breakdown in the social structure more than in other cities. The hospitals were overwhelmed. And the speed with which it hit, because see the brown box? It didn't start until after the peak was rising. And then they started to call for some more quarantine and no social gathering. The next slide
But
shows
is it, just to say,
yeah.
that sounds so familiar, because remember the scenes from New York City before COVID things were put into effect and masking and stay at home. You could have said the same story about New York this time when the health systems were overwhelmed. And I mean, we were shipping doctors and nurses out to New York City to try and help manage the crisis, and so much death. And so much death. We saw the pictures from Italy and other places where I think the health systems were completely overwhelmed. And what happens is you're not just overwhelming for that disease, but once you overwhelm it for all diseases.
And I remember the wonderful service that this program did during the early pandemic to try to discuss with the public, to get the word out.
You're very kind about that. I don't know. We're kind of dorky over here, but it's okay.
That does the trick sometimes. So.
Yeah, it does.
Yeah. So Philadelphia, I mean, next slide shows you a little bit of one of the other things that happened was Philadelphia had a parade just about 2 weeks before the worst day of their pandemic.
So that's probably a bad ploy right
plan.
there. Yeah. Not the right plan.
Yeah.
Okay. And they weren't celebrating an Eagles or World Series victory at that point. It could have been a World Series. Oh, it could have been either one back
then. Could have been, in 1980. Yeah. They weren't as fortunate then. There was a war bonds push, so the war was the focus, and the pandemic seemed like an afterthought to Philadelphia until it hit, and they felt the brunt of it.
Yeah. Isn't that, again, it's so remarkable how similar the story is, but really we shouldn't be surprised of it. What it really is a story of a respiratory disease, a novel respiratory disease, to which we have no real immunity, with a high mortality rate because of how severe the disease, what it does to your lung, gets into the population, spreads rapidly, and we see the type of illness, injury, and death that those slides show.
Yeah, and with no treatments at that point.
Yeah.
I looked at, I compared what happened with the development of polio vaccine versus influenza vaccine, and the speed of our technology just improved so greatly then come to COVID and COVID. So in influenza, between identifying the agent, creating a diagnostic test, creating a vaccine took decades and decades, whereas with COVID we could
40 and 50 years.
In a matter of months.
You know, it always distresses me. I hear people talk about how we don't need to give people vaccines, especially young kids. And it's like we've just forgotten.
Yeah.
And I remember when I first started in pulmonary medicine as a resident in the 80s, and then started in pulmonary in the 90s, early 1990. And we still saw patients who had had polio and had respiratory disease from that, who were then older in life and struggling to breathe. And you just don't see that anymore. I think, okay, if we don't vaccinate people, we're going to go back to that.
Yeah.
It's a terrible lifelong consequence.
Yeah.
It doesn't just go away, and it's such a bad decision.
Yeah, no, yeah, and the polio story is one of those success stories too. So the residuals we have are so much less than we would have if we hadn't been moved quickly and got a vaccine and did a national program to vaccinate the whole population, which is one of the more successful vaccine programs we've had. A lot of people post-war were very engaged publicly. There was a sort of spirit of unification right after the war, and vaccine programs were adopted like as
well. The Spanish flu must have still been remembered. And Hawkeye, I know, is that a student of infectious disease, a practitioner of infectious disease, this story has got to be near and dear to your heart.
Yeah, I'm glad our show today is 2 hours, because I think we could just talk for hours.
Well, you can talk for 2 hours if you want.
I agree with Dr. Krenner. I'm so thankful he's on the show. That was certainly interesting when he showed the New York City graph on the spike in deaths, but also the measures that were put into place. You know, thankfully they didn't have influencers and people who did their own research back then, and people were following some guidance to help save their lives and save their families' lives. The other thing is it's really interesting when we were talking about cholera and the sanitation that occurred. I think one of the fallouts of that was that people at the young age then, because sanitation was so good, were no longer exposed to polio. And so what you had later on, certainly Dr. Krenner, correct me if I'm wrong, is you had that new outbreak or epidemic of polio and poliomyelitis and the paralysis. And so thankfully we did develop a vaccine, but really that polio epidemic came about because of good sanitation, where the very, very young children, young babies and infants were not exposed to polio at a young age. And so what happened is when they were exposed later, they had that higher risk of poliomyelitis. So thankfully, though, we have these vaccines, we have the science and medicine. They've proven to be safe, and they continue to be safe and work.
You know, we've talked about it, and it is this whole story and the repetition of it. It's difficult. Now, pandemics can affect humans, even if they don't infect humans. Talk to us about the Irish potato famine.
Yeah. So I told you about the first modern pandemic, that was cholera, and the worst modern pandemic, probably influenza. But the one that hit the hardest in one place at one time was actually a pandemic that just struck one isolated part of the world in a way that was dependent on kind of the social structures and some of the deficits and problems that they faced. And that was the Irish potato famine, which we don't think of as a human pandemic. But this is a map of the spread, pandemic spread of the blight that killed potatoes. Everywhere, everywhere you see in yellow there was an area where potato blight hit. In most places, it was a nuisance. It was a disruption for farmers who were potato farmers. There was economic loss, but there wasn't loss of life except in one place where it was devastating, and that was Ireland, where remarkably, small island, population of about 8 million. 1/4 of the Irish population either fled in desperation or died in the course of this pandemic. Almost unrivaled kind of decimation from a disease
like
that
2 million people.
2 million people were killed or fled Ireland just to survive.
1 in 4.
Yeah.
And was that because it wrecked the economy and they just didn't have food? People were starving?
It was famine. It was a famine that was predictable if you looked at it from a certain angle. The Irish were colonized by the British, essentially. They were part of the nation, but they were sort of directed and run by British interests, and pushed into a system of very small tenancy farmer plots, no large pieces of land. Individual families each owned a very small plot, and then they helped with the farming of these large wheat producing areas that were internationally traded through the British market. So in that situation, they found a solution themselves to having a small plot of land and high caloric needs. It was a growing population, lots of children. Potatoes are terrific for that. They grow in a small area, produce a lot of calories packed into one, nice little skin, and they became the major, almost exclusive source of calories for the Irish diet over the course of a few decades. So when the pandemic hit, it eliminated the entire potato crop for 1 year and then another year, and it was famine. There's a famous a Nobel Prize winning economist who says famine is almost always a political event. There's always food somewhere, and the British reacted poorly in a way that brought down the Prime Minister at that time too. So there's a starving population in Ireland. There was this call to import wheat back into Ireland, but that would suppress the international wheat market prices. And so there was hesitation. And it was a constellation of multiple things. This small tenancy farming, this new parasite that got on potatoes, and then the kind of reluctance about wheat markets. And it was a perfect storm. So a blight, a pandemic, bacteria, a parasite that spread over the world, but only caused this catastrophic death in one place because of missteps and a particular kind of social structure that was vulnerable in that way. And that was, there's nothing really quite to compare with that in terms of a pandemic hitting one place in one time.
That is kind of amazing. But you've described also, when we were preparing for this, you described something called the invisible pandemic that wasn't even discovered until 2010, although it obviously had been around a lot longer than that.
It is remarkable that the desire to kind of move on or to turn away from this kind of problem, and so we've missed pandemics. There was a pandemic in the southeastern United States in the 1860s of smallpox that was almost unrecognized. There was one person who saw a part of it and sort of was the clue to the existence of it. Maybe I have a slide for Alexander Augusta. He was a military officer in the Civil War, and he saw smallpox in the newly freed black populations in the 1860s in the South, and reported back to the federal government. But no one quite pieced it all together. Augusta was a kind of remarkable individual too. He was born to freed persons in Virginia, a small enclave pre-war, freed black individuals. His family was able to get him an excellent education. He wasn't able to get to medical school in the United States because of racial restrictions, but he went to Canada and got an MD, came back, and then joined the Federal Army as a military officer in the Civil War. And then serving after that was serving as kind of a military attaché to the South for health, public health officer. And he said, look, you have a population of enslaved people who are now free but have no livelihood, they have no land, they're congregated in small segregated areas. It's a recipe for health disaster. And he started to see smallpox spreading. Smallpox, of course, had devastated the United States before vaccination.
And there was no vaccine, right?
There was a vaccine, yeah. There was a vaccine by 1790s.
Isn't that crazy?
And that's why we have the word vaccine, actually. It comes from the Latin word for cow, because there was a virus growing on that cows were susceptible to that turned out to have cross immunity with smallpox. And vaccination before the modern version in the 1790s and into the 19th century was just using cowpox essentially to immunize people.
And we're afraid of the mRNA vaccine, but we were using cowpox to stop smallpox.
Just gather it off the cow udder and put it on someone, and
there you go.
They're safe against smallpox. Unfortunately, the people who had been working plantations hadn't had that advantage.
Yes.
They were suspicious of a white force of military officers.
One could understand
good
why.
Reason.
Yeah.
And it was difficult to gather and vaccinate people in that population, and smallpox sort of spread really quickly. So it was a terrible pandemic that almost got overlooked. In 2010, a historian named Jim Downs, who came and gave us a great talk just a few months ago here, went into the archives, looked at sort of military correspondence, hospital charts, and he reconstructed what was probably one of the worst smallpox pandemics to hit the United States. It swept through this freed black population in the Southeast, but never identified as such, not called a pandemic. Augusta was sort of the one person who was crying, calling for the alarm, but it never really took hold. Not as much happened as needed to.
Isn't it? Go ahead.
Yeah.
It's just remarkable to me that we forget what happened so fast. Like we forget, as we were wrestling the fight over the COVID pandemic, we forgot about the influenza pandemic. We had ignored the smallpox pandemic. And I think we refused to learn the lessons. I remember there was an article in the Kansas City Star describing the difference between Kansas City and St. Louis in the influenza pandemic. One city used precautions, one didn't, and the death toll was much higher, not surprisingly, in the city that didn't use any type of masking or public precautions. And I also remember talking about how we ignored the things that have happened. I still remember the HIV epidemic. You and I, we were talking before, we're the same age, and so we grew up with it. And I was a resident.
Right in the early days.
Rochester, New York, and I remember 1986 to 1990, as a medicine resident, we admitted all the sick medical patients, not the surgical, but the medical patients. 1/3 of the patients we admitted to our service had AIDS. 85% of them died on that admission. COVID was terrible, but when it came to watching the death toll of young people, I don't think there's anything that, in my experience, is ever compared to the AIDS epidemic.
Do you think, did that shape you as a doctor?
Oh, 100%. 100%. It
remember
was
those
a
days.
prolonged, and you just, it was such a tragedy. And I had family members dying of AIDS, and we had patients in the hospital dying of AIDS, and you were absolutely helpless. And it's a different world today, but
Yeah. Now
that
it's a
is
chronic disease managed with
Yes.
multiple medications.
Yes.
Yeah. And I remember delivering as a resident a diagnosis of AIDS to a patient, and just the tears and the terror that invoked, and how hard that was.
Yeah.
See people with no good treatment for these multiple.
We lost so many
opportunistic
hemophiliacs.
infections.
I mean, it was so many people. You can't even begin to describe. So many people in the arts community, the
Yeah.
music community, so many different places. It was a
Yeah.
true tragedy. And Hawkeye, I know that still strikes your profession deeply.
Oh yeah, I mean it's but just as you said, we have medications now. But I was growing up with it, learning about it, not quite in medicine at that point. But it was just horrible, and it impacted the patients, their lives, their family, their friends. It is much better now, but I think we're seeing some of the same issues that initially were plaguing, if you will, that epidemic, and really a lot of social strife and social issues. But it's certainly improved now as far as medicine goes. And to your point, Steve, before, we do have recency bias. I mean, it is multifactorial why these things continue to happen with a little bit different details, but it's a recency bias. It's also just lack of knowledge or understanding of the past, because we've seen these things before in different forms. They're the exact same things that seem to be happening now, and we just need to continue to work towards getting people to understand, teaching about the history so that we can avoid some of the missteps that were taken previously.
Yeah, and just to say out loud, when I would read the newspaper articles about the influenza pandemic of the 1800s and the amount of public, discourse and anger and hostility about masking or not.
There were mask riots.
It sounds like COVID again.
Yeah.
What did we learn, really?
Yeah. I brought you this book, too. This is the first history of the 1918 pandemic. It's called The Forgotten Pandemic. People wanted to quickly move on in 1918, and the book talks about how fast it was set aside. I mean, denial is a powerful and it's kind of sometimes dangerous tool. People didn't want to think about the pandemic once it was over.
Yeah.
So historians in some way kind of held on to it so that we could go back and see the lessons from that time about the difference between New York and Philadelphia, for example. But there was a lot of public desire it dropped out of the papers, it dropped out of the public media.
And we didn't learn a big public health lesson then.
Yeah.
And it's like we've already forgotten the things we should be working on to prevent the next one now, because public health is unpopular when you even start to say it. People are just angry about it.
Yeah.
Well, if you have questions for Doc Krenner, or Dr. Krenner, Doc Hawk, or myself, please send them using the links on your screen to YouTube, Facebook, the X platform, or email the Medical News Network. Let's check in with Dr. Dana Hawkinson, our Medical Director of Prevention and Control here at the Health System. Our COVID numbers have dropped again. It's a good day.
Yeah, it's looking real good. Active infections, 12 in the hospital at this point, none with severe illness, so that's always good. Last week, we talked about how we had increased influenza admissions compared to COVID. We don't have our numbers for this week yet, but hopefully those numbers are going down as well. We know a lot of people are traveling this week, so certainly, hopefully they can continue to do that. Those public health measures, those individual health measures, always wear a mask if you're feeling you need to, if you're not comfortable. I think more importantly for everyday life also is very good, adequate hand hygiene, washing your hands frequently or using the alcohol hand sanitizer, and really trying to avoid putting your hands in your eyes, your nose, your mouth. So I think those are the big issues that will hopefully keep people well. And obviously we know that probably people are traveling. A big place to go is Florida for spring break. Everybody be careful there. Hopefully everybody is caught up on their vaccines to keep themselves and their families safe.
Hawkeye, I think you go back to the spring of 2020 and where we are today and everything we've just heard our discussion with Dr. Krenner. Thoughts that you have about the beginnings of the pandemic and where we are today?
Yeah, there's so many thoughts. And again, we could do 2 or 3 hours on this topic. To the point that you made earlier when we were first sitting around the table, I mean, to be fair, there was probably less circulation of the virus of SARS-CoV-2 at that day and that point in time than there is going on right now. And I know we had the Big 12 tournament shut down. Everything else was shut down from there. But just to put that in perspective, there was probably less circulation of the virus going around in any one community than there is currently. The other thing is, we are now one globe. It is one plane flight from one side of the earth to the other. It doesn't really seem like those travel restrictions helped too much, those flight restrictions, because we know once this type of infection gets into the community, this very easily spreading when people are not having symptoms, aerosolized or airborne spread. Once it's in the community, that horse is out of the barn. So we can look back and hopefully draw conclusions, but also make preparations or changes should we need to in the future. So I think that is a big thing, just having people understand that we are no longer such, even in 1918, although people were flying around the globe mostly for the war, especially the troops, as you had talked about. But really now one person can get on the plane on one side of the globe and within half a day be on the total other side of the globe. We all need to act as if we are on this planet together, because we are so linked, and we saw that with supply chain shortages. We saw that with worker shortages because of that. So there are many things to untangle, and we need to continue to evaluate that and really try to make preparations for the future. Hopefully this thing will never happen again in our lifetimes, but we just understand that we are in a chronic battle, a timeless battle with the world around us, whether it's influenza virus or cholera. Thank the Lord that smallpox is no longer on this planet. It is eradicated, but we are in a constant battle with the world around us, so we need to continue to be vigilant, really try to protect and give everybody the information so they can protect themselves and their families, and then try to protect our communities as well, because we are linked to so many other communities around our country and around the world.
Yeah, exactly.
If you have another minute, Dr. Hawkinson brought up the impact of air travel. There's a great historical example of that. I had a slide earlier in the slide deck that shows Iceland and what happened with air travel in Iceland. If we could show that. There you go. So if you see, we usually think of a cycle of flu as happening every year, but if you look at the early part of Iceland's pattern, it's every 2 years they're seeing an epidemic of influenza. And it changes after about 1945 during the Second World War to the more predictable yearly cycle. The best theory about that is that it was an isolated population that built up immunity and took a long time to get to the level where they would get infected in 2 years. But with air travel, you're bringing in many more new strains, and you fall into the usual pattern of yearly pandemic cycles. So it's actually measurable in the impact of just flying people around the country, how much that changes the way viruses spread and the impact it has on human populations.
It is remarkable, isn't it? Well, sitting in our studio, or in Studio B, is Jill Chadwick, who's in for Alexis today. But Jill, this is like old times 4 years ago, because you were the one handling the questions. So welcome back.
Thank you. Thank you. This has been really interesting, and we do have questions and comments. Joellen and Lisa, they love this program, and they suggest that we do more medical history, and we'll take that under advisement for sure. Joellen, who calls herself a geek, wants to know if Dr. Krenner has written any articles or books on today's topic.
I've written articles and books, none on today's topic.
So you're actually a fairly prolific writer. So he's a very humble man, but he's written a lot of books and articles.
Yeah, but maybe I should, after we get off, maybe I can get over there and jot down some notes from this discussion. It's been fun for me too, and I'm getting new thoughts every time I talk to people about these topics.
We should send out or somehow let people know of his bibliography, Jill, because he's got a pretty extensive one.
Yeah. That sounds interesting. Paul wants to know, could you speak to the epidemic of loneliness and how you are seeing this affect patients?
Oh, that's a great question. And that we talked a moment ago, Dr. Kreiner, that we talked about this as the trade-off, right?
Yeah.
When we look back at the COVID pandemic, there is no question, there's no question, and we saw it in the influenza pandemic, and we saw it again, that public health measures bent the curve and blunted the impact of not only death from COVID, but death from other diseases. Because when we had a health system that was overwhelmed, we remember that we were overwhelmed and didn't take care of all the people with heart attacks, cancer. Patients with cancer wouldn't come to the hospital, then they died from the cancer. People wouldn't go get their diagnosis because they were afraid of going to the hospital. Patients with sepsis, well, remember the discussions we had about the inability to people transferred out of a rural emergency room into a place where they could get the appropriate care for a heart attack. So when you get overwhelmed as a healthcare delivery system, it doesn't just affect the people with the disease that's overwhelming the system, it affects all diseases. So you have to weigh that against what's been clear was the epidemic, as well described by our listener, of loneliness and seclusion that really affected, and it continues to affect the mental health, I think, especially around some young people and people who were really trapped by that, especially in our older population. Which one's right and which one's wrong? Well, we're in healthcare, so it's hard to say what's right and what's wrong. What we know is there were a lot of people we couldn't help during the height of this pandemic.
It was, it was, Kansas City did an admirable job of flattening the curve. Our hospitals did
We did a great job.
We did a great job.
Yeah.
Yeah, I mean, we didn't have the overwhelming surge
we
that
weren't New
took
York.
Places like Italy completely out of commission, and people lost their lives not because of COVID, but because of the failure of the social structure in addition. And I mean, I think loneliness has been a problem before pandemic and continues to be a problem. There's a lot of factors going into that that don't relate to things about isolation from the disease. I mean, there's difficulty of social media and the difficulty of loss of kind of places where people gather that happened well before the pandemic. There's a wonderful book called Bowling Alone about the loss of bowling leagues, which used to be the big social groups or the PTA or different kind of organizations that we used to all gather from in cities. And now we're much more in our jobs, in our homes, but we're not really meeting one another in other places. So there's kind of a lot of things factoring into that weren't related to the pandemic.
So there's something about the public health measures, but also just society in general led to some of that. That's a great point. Jill.
Amy, who watches the show and she hears Dr. Hawkinson give the count every time, wonders, since 2020, have we ever gone a day with 0 COVID patients?
I don't believe we have, Hawkeye. I don't think we've ever been back down to 0 again. Maybe this spring. We got down to 2 or 3, but we've not been to 0.
Yeah, you're probably right. I know it's definitely down to those single digits, 2 or 3. I can't remember if for a couple days we were down to 0.
Yeah, I don't think so.
That is what we are pushing for. That is our goal. But,
And Jonna wants to know, with your historical background, Dr. Kreiner, when all this was going on in New York and you see it around us, were you having predictions of what was going to happen? Could you see this?
There were historians of the charts of New York and Philadelphia were by a group of historians who wanted to make sure we were learning lessons from the 1918 pandemic that we could apply. So no one sees the future, but there's a lot that you can pick up in the way patterns happen in the past that can be helpful. So I think there's been a surge in people's interest in writing histories of pandemics just for the purpose of trying to gather what we can take away from them.
Michael questions, do we really learn from history? He's pointing to the measles outbreaks in Florida and as close as Chicago. And he said, have we forgotten our history? Are we doomed to repeat it?
Yeah, it's an interesting question. Yeah. Fortunately, we don't have a wholesale measles outbreak. We have more limited stories, which before, I think, if we completely ignored history, it would have been a much bigger problem for us.
Yeah, I think what you learn from history is it's difficult to get these messages out, that there's barriers to our public health measures. Public health is always in tension with kind of public liberties, and it's always a challenge. And I think these kind of discussions and communication is one of the mechanisms we can draw people in to better understanding. So history is not the solution, but hopefully it kind of provides more information that we can use.
History is the lesson.
It is the lesson, yeah.
Yes,
If you
and
can,
ignorance is not the solution either.
Sometimes the lessons are a little dull. So you gotta be
No, they're not. They're fascinating. I love history
I only liked it later in life.
I loved history.
Yeah.
We have two more questions that I think are really good. Blake wants to know, is the health system doing anything to collect and preserve COVID artifacts? And what would those be?
Well, I don't know what the health system is, but Dr. Krenner is really good at that question.
We have a terrific museum of medical artifacts, and we're also an archive for the correspondence and the publications for the medical center. And so we're constantly trying to create a historical record of what's happening in the times for the future. And that's why we exist mostly. The Department of History and Philosophy of Medicine is a repository for artifacts, books, manuscripts that tell us how medicine has evolved over the centuries. And hopefully, a place to mine for information like they did with looking at Philadelphia and New York to gain some lessons for the future.
Okay, and Terry gets the last question. She wants to know, how do you hope history will remember COVID?
That's a great question.
It is a great question.
I think I would like us to remember the ways people pulled together. In New York, it was incredible pressure, but the health system held. People came out and did their singing and their chanting for the health workers, and I also think it's important to remember just how starkly pandemics expose the weak places in our society, and hope that we can use the vision that we have of where inequality and disparities lead to greater suffering as a way to guide healthcare in the future to provide care where it's needed most. Pandemics are like an X-ray of the social conditions and expose some of the places where we need help. I think medicine's one of the remedies for that. A great physician from years past was Rudolf Virchow, said that physicians are the natural attorneys to the poor, because they see that disease, illness, and poverty track together, and that medicine can be a place to use the leverage of science to kind of rectify some of those some of the worst places where we see suffering and early disease and death.
This has been one of my favorite programs here, most favorite program, because I so appreciate the perspective you always bring and the information you provide us. I'd like to get some final thoughts from everyone. Dr. Krenner, we're going to start with you. By the way, thanks for being on the program.
Well,
Jill, I have a new idea for another program series. It may involve some medical history.
Yay.
Right.
Well, I've
Can I
always
have a
admired
final
this show
thought?
forever. So
Yes, you can.
Yeah, go ahead.
Go ahead.
I just want to thank you and Dr. Hawkinson and the health system and our viewers in the media, because I think a lot of people were terrified. I know that I was, and you all made us feel safe and made us feel like we had a tiny bit of power and control because you taught us. So that's what I would like to say is thank you.
Well, you're very kind.
Absolutely.
Thank you.
Yeah.
Thank
and as a
you.
physician, it was just being connected through this show, and feeling that there was common purpose. This show helped a lot through that time too. So I'm delighted to have a chance to join you here after watching it for so many years.
Well, you're very nice as you always are, and thank you for being on the program today. I have a feeling it's not your last appearance. The problem is when you do a good job of the program, you get brought into the vortex, you're brought back to it. Doc Hawk.
Yeah, I would say, I think we need to continue to learn from history, and we do have our, particularly when we're talking about health topics in history, we do have our physicians and our scientists learning about that, and our public health, and we do remember it, and a lot of people do remember it, but it's hard to go back because a lot of people don't remember it and don't understand. So I think it's important to continue to study history, and then draw inferences and make conclusions and try to apply it to any local events or more recent events that may occur. I think one really good thing that came out of the pandemic was the ability to develop and show safe and effective vaccines and medications. Also showing that public health measures do work. And we have to measure those things also with, unfortunately, like we had heard about the loneliness and the epidemics that occur with seclusion. And so I think there's a lot of lessons to be learned, and it's going to take years and years to tease those out and really try to do things optimally should, heaven forbid, should something like this occur again. Just one thing I'd also like to bring up, a recent article published in The Lancet, if we're talking about the United States in general, unfortunately, when they looked at 37 high-income countries, the United States was the highest excess mortality of all those countries at again, excess mortality during the pandemic. So what that tells us is there were a lot of things that we probably could have done differently as a country. Obviously, we know it is a large geographic footprint. There's a lot of different communities, a lot of different opinions on that. But hopefully drawing these lessons to help protect our citizens is the best thing to do. And I know that we have our public health people out there doing it every day, our physicians and our scientists doing it every day, and hopefully we can continue that. And really our main goal is just to try and keep you and your family and our community safe and healthy.
Yeah, I always reflect on the intersection of faith, hope, and science. Faith that we have in each other, maybe our greater faith. I hope our faith in science. Because what we've learned from this, whether we're talking about cowpox being used to help with smallpox in the 1800s, we're talking about the impact of public health measures, which clearly blunted the impact of influenza in New York versus Philadelphia, or with Kansas City and St. Louis. Whether we talked about public health measures bending the curve around the COVID crisis, which it clearly did. If we can believe a little in the science, we can help take care of each other. I do think one of the lessons learned from this pandemic is that people will listen to reason when you have a rational, fair, and honest discussion about it, as opposed to one where people are going to just shout at each other. But when you actually root your discussion in honest truths, as opposed to political truths, people will listen. And I think that's one of the things we should take away, is that there's a lot of good in the world. And the best way to handle the evil is just have an honest, faithful discussion, rooted in science, rooted in telling each other the truth, and rooted in compassion. Faith, hope, and science are a powerful combination. And as the words of a Star Trek fan, together we can live long and we can prosper. That's it for today. We'll see you next time.
A young mother to triplet toddlers knew so much was at stake. I'm Alexis Del Cid on the next All Things Heart, how doctors discovered a potentially deadly condition and how they saved her life.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.